In this video, I want to be talking all things the foot, and most notably, I want to explain why your foot might be hurting and what you can do about it in order to get back on your health and well-being journey. Speaking of health and well-being journeys, if you're new to our channel, my name's John, head therapist here at John W Sports Injury, where I want to be doing for you 3 simple things on this channel. Get to know your body better so you can get rid of pain and weakness, strive forward and hit your health and well-being goals. But in order to do that, let's talk about the foot. And why is the foot so important? We all know about our 10,000 steps a day. But what I always want to be getting across to people is that we wouldn't try to build a house on poor foundations. And that's where the foot comes into play. It gives our body that foundation in order to go about our daily lives. So we need to make sure that the foot is right. But what I want to do in this video is explain that if you are getting foot pain, where that might be coming from and what you can do about it. But what's very important to state at this stage is that if you are suffering pain, I would strongly always recommend getting an individual diagnosis from a medical practitioner who will be able to help you with a personalized rehabilitation program. But let's dive through the areas, and we're going to talk about if you're getting pain on the top of the foot, the underside of the foot, the inside of the foot, the outside of the foot, and the back of the foot as well, and what they might be. Let's start with the top of the foot. Well, the top of the foot, we have some crucial tendons. Now, these are tendons that you can actually see, particularly if you pull your foot up. Now, why do we see those when we pull our foot up more prominently? Well, they are the tendons of the muscles of the shin. So in our shin, particularly the outside of our shin, so if we find our big, thick lower leg bone called our tibia and drop onto the outside, we have some key players in there. That's our tibialis anterior muscle and also our extensor digitorum longus muscle, or what we call EDL. Now, those muscles can run down and turn into those tendons, or they do run down and turn into those tendons, if not can do. But what I was going to say, what can happen is that if we're using these excessively, so particularly can come about if we've changed our exercise levels or changed our exercise surface or something that's creating more tension in the area, is it can lead to dysfunction in the area. The problem with these muscles is that they're very difficult, debatable, impossible whether we can actually stretch them. So I sometimes term these the unstretchables. And what I feel actually benefits further is by getting in and doing some self-massage in the area. Now, you can use your hands into that area, finding those sore points and looking to work them through, using a ball in that area. So my trusty old lacrosse ball that I like to use to loosen through that tissue can be really helpful. So that's the top of the foot. What about the underside of the foot? Well, typically on the underside of the foot, we have a condition called plantar fasciitis. Now, all of the conditions that I've spoken about, so the last condition being shin splints, this one being plantar fasciitis, you will find more detailed videos from me on this topic within this channel, because each of these conditions deserves a video in its own right. But what I'm looking to do here is just to scoot through the foot and explain some of those common conditions. But the plantar fascia on the bottom of the foot, this is a thick band of fascia that we have. Now, the key thing here is that it's connected to the calf complex. So in the back of our leg, we have our calf complex, so our gastrocnemius and our soleus muscle, and they run down and ultimately attach, or connect, I should say, really, to the bottom layer of that foot. So if we're creating a lot of force from above, that can actually pull on that area. So what can we do about that? Well, we have a couple of ways of managing our symptoms. So using something like ice on the underside of the foot could be really helpful. But again, using something like a ball, so placing the ball underneath the foot and looking to roll into that area by moving your foot backwards and forwards across the ball can be really helpful to break up any of those adhesions, release any of that tight tissue. But what we need to remember here is we're just managing the symptoms. You know, if you're a regular watcher of my channel, that my key message that we have to get across with injury is that we have to correct the cause. So the cause here a lot of the time could be multiple things. Footwear can be a big player. Amount of exercise that we're doing and the way we're doing it could also be a player. But if we're tight in that calf area, that's an area we want to address. So performing things like stretching of the area using our gastrocnemius stretch, so when we've got our back leg nice and straight, and importantly that heel being nice and fixed to the floor, as we then bend both knees forwards, you can feel that stretch in the back of the leg. Or we've also got another muscle in there called our soleus muscle. So this muscle, we can perform a very similar stretch, but actually you'll note that the back leg is bent in this stretch. So what that does is really pick out that soleus muscle to get a good stretch in that area. Again, reinforcing the point that those heels must be super glued to the floor in order to get a good stretch in those areas. But speaking of those two muscles being the gastrocnemius and soleus making up our calf complex, they have something in common, that they use a tendon called the Achilles tendon. The Achilles tendon runs on the back of the foot and attaches into the heel. So if you're somebody who suffers with pain on the back of that heel bone or in the really lower part of that leg, then actually it's very much worth getting your Achilles tendon checked out, because it's a very, very common condition. So really we would look to treat this in the same way as the plantar fasciitis in terms of the stretching work through the calf complex. But the difference when we get tendons involved is it's very important that we load these in a progressive manner, so a way that is right for the body to safely return to sport and exercise. So if you do think you're suffering with Achilles tendonitis, yes, stretching may be helpful, but you want to get yourself a nice progressive plan that can load that tendon in a safe and progressive manner. But that takes us through the top of the foot, the underside of the foot and the back of the foot. What about the sides? Very common to suffer with pain in the inside, so with the inside or the outside of the ankle. So let's start with the inside. Now we have this bony lump on the inside of our foot. We call that the medial malleolus, or the inside of the ankle I should say. It's actually the bottom of your lower leg bone. But we have a structure that kind of wraps around that. So if you're suffering with this kind of nagging pain in that area that you notice becomes worse when you do more repetitive exercise, then what could be going on here is a condition that we might call PTTD, Posterior Tibial Tendon Dysfunction, or an issue with our tibialis posterior. Now again, I have a detailed video about this condition within my YouTube channel. But what happens here is that we have a deep calf muscle, tibialis posterior. What does that mean? Well, we have our tibia bone, posterior means the back. So very much living on the back of that leg bone, we have this muscle that comes down and wraps around the inside of that ankle. So it's really key that you address that. And again, the stretches can be similar with a small tweak, which you'll see in my other video more detailed. But effectively, if you're performing those calf stretches, so the gastrocnemius and soleus stretches, and you turn your heel out, you'll feel a deeper stretch on that inside, and that's a great way of catching it. But what I also find is that self-massage into the inside of that shin bone can also be really, really helpful to get in. But I talk about that more in that video. So check out the tibialis posterior video. Now, also within that area, we do have some ligaments. We call those the deltoid ligaments, just living on the inside of the ankle. Now, how can we differentiate between the ligaments and the tendons? Well, tendons attach muscles to bone, ligaments attach bones to bones, but ligaments have a huge balance component to them, or a role in keeping us balanced. So if you're finding the ankle feels unstable or feels sore when you have to stand on one leg, that might be lending itself to the fact that it's a ligament injury. So the sheer nature that we know it becomes involved in balance means that we can rehab it appropriately with balance exercises. So something as simple as standing on one leg and closing your eyes, you'll instantly feel those ankle ligaments working harder. And that can be a good exercise to really start to strengthen up that area. Want to make it harder? Add your something like a pillow underneath to give yourself a balance challenge. But again, I've got a video around strengthening your ankles and improving your balance that would be really good to check out if you think that that's something that you might be suffering with. Then if we go to the outside of the ankle, again, you'll see that corresponding bony lump on the outside of the ankle that we call your lateral malleolus. And we have some peroneal muscles that wrap around this one. Now, the peroneal muscles are the muscles that live on the outside of the leg, and they come down and wrap around and head towards your little toe. So like I said with the tibialis posterior, if when you're doing lots of walking or running, you start to feel an ache in this area, that might really be lending itself to a peroneal dysfunction. And I have a detailed video in this channel that will talk through the exact steps that you want to be taking in order to do that. But also in that area, we have our most common ankle sprain. And this is where we might have a problem with a structure like the ATFL ligament. So this is your classic walking along and you roll the ankle, step off a curb, and you instantly feel pain. But what a lot of time I find happens with this is that we don't rehab it correctly when we suffer it. So you might have recently suffered an ankle sprain, or you might have suffered an ankle sprain years ago but left your ankle weak. Now what that does is that we then start to try and build on these poor foundations and we get cracks up through the system. So if when you're doing that balance work you find that the ankle feels very unstable, or that you feel sore on the outside of the ankle, that is something you definitely want to address. And you might even find that some of these other conditions that I've mentioned, so as a quick summary, the plantar fasciitis on the bottom, the extended tendonitis on the top, the Achilles tendonitis, that might all be coming about because of that weakness and instability at the ankle. So I hope that's been helpful for you. That was a real whistle-stop tour through the foot and ankle, what might be causing your pain. What I would encourage you to do is two things. Firstly, if any of this has resonated with you, then make sure that you get a detailed check by a medical practitioner so they can advise you and provide you with the right treatment and program. But also have a look in more detail into these conditions. And as I said, I've got lots of resources inside my YouTube channel. And the third thing that I want you to do is make sure you hit that like button, because then that is going to help others who are suffering pain to find out what's causing their pain. And has this been helpful for you? Have you liked this content? If you haven't subscribed, why not hit that subscribe button and then the bell notification, and then we will let you know as soon as our next video drops. Speaking of next videos, here's another video to help you on your health and well-being journey, and I'll see you on the next one.